You know one thing where they say that if you are not Nigerian and someone explains Nigeria to you and you understood what the person was explaining, then that means the person did not explain Nigeria to you very well, because you can never understand Nigeria. A whole UCH, University College Hospital, I think that's what they call it, UCH of UCH, a teaching hospital in one of the most prestigious universities in Nigeria. Patients have to bring their own generator for them to fuel the hospital because the hospital has not had light. And you know what is most heartbreaking? Let me even tell you about it. The irony of it, let me read Professor Chidio Dikalo's tweet on it, is that the irony is that Ibadan, the location of the UCH, is the home of Nigeria's Minister of Power, Bayo Adelabo. If the man cannot power up the biggest teaching hospital in the country, which is in his community, is it your village that he will? Professor Odekalo didn't finish it, but let me finish that he will power up. Oh, my tribe man must be there, my tribe man, my religion, the person we share the same religion must be da 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 da. See where it has taken us to. All of us are suffering, yet when we start to put the best person that will do the best work so that all of us will enjoy, we will refuse. Every 4 years we have opportunity, we will do anyhow, and yet we are wondering why we are suffering. The suffering never do us. We go suffer. I know they cause na where we don't, na the foundation where we don't lay. Na the foundation where we lay. You know feel so this thing a weed, then you will say na rice go comot for then. You know fit happen now. You know fit happen. Patients now bring generators to UCH Ibadan for treatment. Meanwhile, federal government is saying that people are coming from UK, US to receive quality health care in Nigeria. Yes, there are people who are coming. Some on their way, they will say like some things. But one of the things that is being pointed out is that it seems as if there's a organ harvesting market here. So people that cannot get a kidney in their place, because over there in Oyibo land, you can't just give these things anyhow. There are specific rules and regulations so that people will not go and be selling their body parts or that have been made, people that have been made vulnerable by poverty. But here they can come to Nigeria and people are ready to want to sell. Even the ones that are not selling, they are doing this thing. What do they call it now? Abducting people, kidnapping people, and using their body parts. So what is it that you know that they are coming from? And even the federal government that is doing that, it's not the federal hospitals they are coming to, it's private hospitals, and these private hospitals are expensive and they are way out of reach of common Nigerians. While Nigeria's federal government claims that the country is steadily being positioned for medical tourism as it presently attracts patients from countries from like United Kingdom, United States, West Africa sub-region and more. Patients at University College Hospital, Ibadan, which has reportedly been in darkness since October 26, 2024, now bring their generators and solar inverters to receive medical care. Reports circulating on social media claim that the federal government-owned UCH has been struggling with power supply issues for months, leaving critical medical services disrupted. Patients and their families have resorted to personal power sources to ensure life-saving treatments continue. In response to the crisis, the Oyo State government acknowledged the situation in a post on X. It said, "Thank you for contacting us. The Oyo State government is aware of the power supply challenges at the University College Hospital, Ibadan. Although the facility is managed by the federal government, the Oyo State government plans to connect UCH to the state's independent power plant as a medium-term solution." The prolonged power outage has sent social media abuzz, with many questioning the state of healthcare infrastructure in the country. While the Oyo State government's intervention offers hope, patients and medical professionals at UCH continue to struggle with the impact of the ongoing blackout. However, speaking to newsmen at the State House, Abuja, about key decisions aimed at bolstering Nigeria's healthcare system, the coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, announced that people are now beginning to come from the sub-region and even from faraway places like the UK and US to receive quality healthcare in Nigeria. So despite what we may want to believe about Nigeria's healthcare system, there are good things happening. The transformation that Tinubu promises. Please, people should stop that. Tinubu didn't do nothing. It's not has nothing to do with him. This is about private hospitals that are out there that are way out of the reach of the common man. And so you can access it. If you have the money, you can. I remember when I did my hysterectomy, I think that was in 2019. It cost me, I can't remember, it cost me I think 2 point something for me to do it. And then there was this one of my colleagues where he was a year ahead of me when we were in medical school. By the way, I was actually supposed to be a doctor before. That was never my choice anyway. So when they closed that was in 1994. I was in level 2 as a medical student. Then when they now closed down ABU Zaria for 1 year, so I left BUK. Didn't give me medicine, they gave me microbiology. I did that. When we returned to ABU, my father asked me to come. I'm like, nah. I told him after I do finish microbiology, I will do the medicine. And the medicine is still there now. So anyway, this particular person, we had grown up together. He was a year ahead of me in medical school, and so he was like, oh, I could have done it at a much lower cost. Was it like 400,000 or 5 or 600,000, maybe less or something like that? There was a hospital he was managing. I was like, okay, me, I cannot put my life in the care of a government hospital, whatever, where anything can happen in the middle of operation if you take life. But so what I'm trying to say is that there are private hospitals, but they are expensive. It's not about we that we can afford it. It's about the common man. Can the common man afford it? Like those government medical cases out there, everybody can afford it. Yes, in US, UK, this thing, healthcare in US is very expensive. Canada, UK, they're free, but there's a long time to wait. So sometimes people, instead of waiting, they would rather just come and do their business. So it's not for them to now start making it look as if, oh, it's the Nigerian government that is doing something, or Tinubu did anything, whatever. He has not done nothing. He has not done nothing on healthcare or whatever. So let the honorable minister, if there's any honor in serving an illegitimate government, let him just focus and do the work. Oga, you don't need to praise yourself now. Do the work that 100 years from now people will be praising you. Thank you, sir. So on Thursday also, it's just a lot of all those psychopathy thing. Let me just leave that one here. But the crux of the matter is that a hospital as big as UCH, there's no electricity. Imagine how many people that ought not to have died, that have died as a result of this. And yet people don't see how corruption, bad governance, lack of accountability, lack of transparency is really killing all of us. At the end of the day, they will be telling us enemies. The Nigerian government is our #1 enemy. Thank you for watching. Bye.